Good morning, class. Welcome back to Lecture 13, Immunology and Immunotechnology. Today we will be talking about a concept called hypersensitivity, or in simply it is known as well known to everyone as allergy or allergic reaction. So we will talk a little bit more on the introduction of it today. So there are basically four types of hypersensitivity reaction. And the fundamental thing is that our immune cells, depending on a situation, they overreact. That overreaction or hypersensitivity or hyperreaction, hyperactive immune cells not only causes damage to the antigen or bacteria that is coming into the body, as a consequence of overreaction, it may harm the host or our own body cells, our own body cells. That is called hypersensitivity reaction. So the consequence of the hypersensitive reaction is sometimes having some skin rashes, a little bit of allergic reactions. You may feel sick, vomiting, but it may go to a point that you may become fatal. It may become fatal, and people might die eventually if not given a proper medical treatment. So we need to be careful on that. So we will talk much about that only in today's class. Four type of hypersensitivity reaction that we will cover two concepts tomorrow, two types, and the other two types in the next class. So basically by this Saturday, we will cover a half portion of Unit 4 that I will show in the slides. Okay, so I have to pause the video, resume record. So we have discussed in the last quiz one of the fundamental question. We have given one, it was not discussed per se, but based on the choices you could eliminate, but it's also an important concept. Immunological unresponsiveness to self-antigens is called. So here in this question in the quiz last week, we were speaking about self-antigens. Per se, the antigens are molecules, chemical molecules or moieties present in our red blood cells. They are part of self antigens only. Same way, the MHC molecule also brings self antigens. That we have seen MHC1 and MHC2 molecule and antigen presenting cells. They are also called sometimes self antigens. In blood cells, we also have self antigens. So basically, we know that our system doesn't respond to the self antigens. That is the fundamental difference in terms of the immunological response or immune response. A particle within the body or self has been encountered by the immune system, immune cells during their development or during their flow in certain cell part of the body through lymphoid organs. They have exposed to it first time, and second time also they get exposed to the same particle. There is a mechanism that immunological memory, and the memory gives a mark to these antigens or chemical moieties as self molecules, and it asks or requests the immune system not to kill the cells because it's its own cells. So there is self-recognition process that constitute to no immune response, no effector molecules. So basically you are fine with your own body, your own antigens given in the self-antigen. So, but on the other hand, if non-self or foreign comes, again here, there is again two step of response. What is sensitization? Second one is effector phase. Any particle that enters the body, self or non-self, the immune cells will get first sensitization. During the sensitization phases, they can pick them as self, don't do any effector action. But if they know that during sensitization that they came to know that these are non-self or foreign, then they have to elicit an immune response through effector molecule. There will be a response from the immune cells that may kill the pathogen or the foreign antigen entering the body. So, what is the system that is in terms of fundamental immunological terms called as tolerant to oneself, tolerant to oneself? That is the English term called tolerance. So, in our system, our immune cells are tolerant to our own self antigens, but they are intolerant. They are intolerant to non-self or foreign molecule. So the choice comes to the question that immunological unresponsiveness to self-antigens is called. It's part of the memory only. The memory involves in the process, but it is not the definition of it, not the phenomena. It is called tolerance, and the tolerance may be implemented by an immunological memory. So these two are linked. These two choices you can eliminate because the self-antigens, you may not get a response of ADCC, antibody-dependent cell-mediated cytotoxicity, or acquire immunity in terms of B and T cell activated. It may not happen per se in given situation to self-antigens. These two choices can be taken out, Given the memory and tolerance, you're talking about an acquired quality of any system or body or immune cells. It's a memory, it's okay, but tolerance is the one that's wrong. And responsiveness to self antigens is called tolerance. And responsiveness to foreign antigens is called intolerance. And then we will see today one more term, responsiveness to self antigens. And responsiveness is tolerance. Responsiveness to self antigens, if may happen, what it is it called, we will see that. It's nothing but it's allergy. So coming back to again revision in terms of the humoral and cell mediated immunity, how they act, what they do. So you can see that. I hope everyone is following it. If you have a problem with the recording, you raise your hand and chat in the chat box. So as I muted everyone, I don't know how the system is working. If everything is fine, just leave it that. If any issues with the recording, you make a hand raise or make a chat box comment in that. Thank you. So basically we are looking at two immune cells or systems, humoral immune system, cell mediated immune system. In humoral, antibodies play a key role, control of freely circulating pathogens. You see that humoral means body fluids, antibodies are freely going into the body fluids. They encounter extracellular antigens, that is the antigen antibody complex, mainly the B lymphocytes are involved. Then they differentiate into plasma cell and memory cell. The plasma cell will produce clonal propagation of whatever the antigen recognized by specific antibody, and it propagates the antibody in more multitude way. So again we have seen a crosstalk that in T cell mediated also there is a kind of recognition. Antigen presenting cells will bring molecules or antigens, and the T cell recognizes them. Once it recognizes, it goes into a kind of two processes or three processes. One is kind of T helper cell. That process is to help only. It may help in terms of memory, or it may help in terms of the crosstalk with the humoral pathway, make the antibodies crosstalk with the antibodies. Or it may go into another pathway called cytotoxic T lymphocyte, CTL or TC lymphocyte, where a specific lysis of that target cell happens through a specific interaction with the cytokine production that we will expand. We have seen little bit in the transplant rejection, but I have received that we might have to revise that. Some students did not understand it. It belongs to part of the type 4 hypersensitivity, and given that class, we will expand it a little bit more detailed and take some time. In other kinds, it's a macrophage activation can happen. So this is fundamentally how B cell and T cell will act. And given a scenario, if you take only humoral immune response or antibody immune response, we have spoken that in a case of that, antibody can also induce cytotoxicity to kill certain specific cell, a phenomenon called antibody dependent cell mediated cytotoxicity, ADCC. So basically, if any some virus infected cells or some part of the target cells, the antibody bound to it, it recognizes through FC receptors that present on the constant region of the antibody. Then it acts on different cell types. It recognizes through FC receptor. Then it elicits or it crosstalks with natural killer cells, inducing a cytotoxic effect. Or in general, if you take antibody, we have revised it in the class in the first few lectures, that it goes through several processes in molecular mechanism, biochemical mechanism. The first thing is that it acts through complement proteins, antigen antibody interaction, classical way elicits some complement proteins which bind to the specific targets that allows into subsequent targeting the cell and subsequent lysis through complement lytic pathway, that is C9 complex that comes up there. On other way, we have known that these complements sometimes act as opsonins. They bind to specific antigens. This binding of these opsonins on the bacteria or virus particle makes the phagocyte to recognize them and opsonize them, basically phagocytose them. Or other way, we have seen that classical inflammatory response, the way fever comes or inflammatory response, the complement receptor binds to a specific pathogen or specific molecule per se, binding of that, and any binding to that elicits a response called extravasation or vasodilation. For example, normal blood cell given a normal thickness, normal basement membrane, distance between the cells, the membrane on the upside of the blood cell, it will have a normal elasticity and it will allow only certain cells in a given situation. But when a situation of that something happens, extravasation happens, vasodilation happens. For example, the blood cells or the circulatory system expands. Expanding that basement membrane gives gaps between the connective tissue on the top layer, basement membrane, so that it allows extra flow of immune cells to come into the spot, because they think that there's something bad is happening to the cells or tissue here. So the surveillance mechanism of the police is only immune cells. A lot of immune cells will come, so they need to be dependent on the size of the cell. They need to go into the blood cells in the spot through the blood vascular system. So there is extra dilation happens, so that pores will come. Immune cells can pass through the blood easily in this given scenario. And consequently, it may find that the complement bind to specific cells of the immune cells. For example, mast cells here, recognition of this complement gives a specific process called degranulation. The mast cell already carries a lot of vacuoles with biologically relevant important materials, histamines, and this binding asks them to degranulate, basically vomit. They die and they vomit whole of these vacuoles out into the body. The vacuoles contain histamines. The histamines will have a specific response. Given the concentration of the histamines, it may kill only pathogens. But if too much histamines are flowing through the blood cells circulatory system, it will be a kind of negative consequence to the system. That it is these kind of things are talking in terms of either a complement pathway or there is an antigen antibody interaction, one-to-one binding of antigen antibody that elicits these responses. But in a given scenario, we are not working singly. There is tons and millions of antigens, tons and millions of antibodies. Same way many of the complement proteins are produced. So they exist in as a complexes also. Antigen antibody complex intertwined with complement proteins. So these complex all together may be floating in the body, floating in the circulatory system. So one antigen, one antibody binding may elicit some response. But if the complex of antigen antibody is going around and it is touching specific immune response, the response of the immune system may be different. That is also really important. You're talking about a one-to-one interaction. You're talking about antigen-antibody complex interaction. This also has a consequences in terms of allergic reactions, how the pathway acts. So we will see that. In allergic reaction, if a pathway of the B cell is involved, it may act as a B cell one antigen antibody interaction. It may elicit any of these three responses. But if it is acting as the same B cell in a complex with antigen antibody, like not only one B cell, one antibody, a complex of them together acting, it elicits another mechanism. That also varies in terms of the allergic reactions. So again, coming back to fundamentals, self, non-self reaction, tolerance, intolerance. And what about this same intolerance talking in terms of hyperactive or overactive immune cells? We are talking about non-self, self-recognition, unresponsiveness here, responsiveness here. Or you flip it here that the unresponsiveness becomes responsiveness here. The self may be also destroyed, or both self and non-self may be taken into a kind of not only a specific dose of 10 macrophages coming and attacking there, giving the bacteria small cell. Rather than that, in a given small pathogen or foreign entity entering, there are 100 mast cells are coming, 1000 basophils are coming. So somehow they are all triggered to do a small initial communication with the antigen. They were able to do and come to the spot in a overactive populations, and they are becoming hyperactive. Though the dose of the antigen is small, there are normal dose requires 10 mast cells, but in a situation there are 1000 mast cells in the same response, and all of them are overactive. They immediately burst out and releasing a large amount of histamine. So that's called as hyperactive or overactive immune cells in a given scenario, normal scenario. So what are the consequences of it? What happens when the immune system is hyperreactive either to self or non-self antigen? What happens? So it is nothing but hypersensitivity reaction. So to go into that further, you just take the fundamental response of what is the protection of body. Immune system protects us. For example, there is a trigger. Triggers may be several times, several categories. We will see here slowly. The immune response based on the trigger may be just right. Just right means normal things are going normal. Immune system is not stressed. You are not stressed and everything is going fine. You are healthy. But immune system in a given normal condition, it is too low response. The response is too low, then you may get an infection. You may get a viral fever, bacterial fever, or cancer is also fundamentally immune system dependent. If your immune system is not working proper, cancer also spreads. Working proper, cancer spreading like metastasis stops. But these two scenarios are either working or not working. But in the third category, it's working very hyperactively or overactive working. What happens in this scenario here? So when the immune response is too high, given the trigger, maybe a pathogen, if it's too high, inflammatory damage can come. In a cancer, it's okay, not that much has been observed here. But in a transplanted organ, normal situation, HLA type matching, small discrepancies, organ is accepted. But if it's too high differences, there is a high response, organ is rejected. Innocuous foreign substance that you don't know what it causes, initial stage or normal, little or no response. But if this foreign substance is an allergen that causes allergy, then there is allergies will come up, high response will come up. In terms of self or own cells, no response, normal is fine. But if it responds to self cells in a heightened response, that is called autoimmune disease. So this is fundamentally the trigger immune response, how it acts. In each of these situation or scenarios, it elicits an effector molecule to defend this immune response, defend this the foreign invaders or different circumstances. Immune response, trigger, effector molecule. That is the triangle you need to understand. So that comes to the fundamentally importance of the chapter, Unit 4. Unit 4 talks about hypersensitivity reaction, or when the immune overreacts. It also called as allergy or allergy concept. It's synonymous. Hypersensitivity reactions are how the immune system responds. They are based on the response. They have been categorized into type 1, type 2, type 3, and type 4. We will look briefly today, and then we will take 1 and 2 tomorrow's class, 3 and 4 on day after tomorrow. We'll look into that. What are the symptoms? What are the immunodiagnosis that you need to look? And the second part of the Unit 4 talks about specific molecules called lymphokines or cytokines. They are part of the interleukin and interferon chemical molecules. They are also important. They are also important in immunological tolerance. We may speak briefly here in which pathway they come. But when we take this chapter next week or maybe one more week later, we will look in more on that. What are these chemical structure, pathways, how they act in terms of immunological tolerance. So coming on to hypersensitivity in terms of definition, it is also known as hypersensitivity reaction or intolerance, refers to undesirable reactions. Undesirable reactions produced by the normal immune system. That response comes through a kind of allergies or autoimmunity. They are usually referred to as overreaction of the immune system, and these reactions may be damaging sometimes, may be uncomfortable sometimes, or occasionally they may be fatal or undesirable immune response. So a classical example, what we can think of this hypersensitivity of overreaction. I don't know if I'm blaming some students or not. From past few classes, let's say our class is a normal immune system, normal immune cells. From past few classes, we are seeing one corona guy jumping and speaking some nonsense in the class. Maybe he's part of our class or it's a Zoom bombing, other guy is coming. But it's a classical example that our own immune cells, like me and you are immune cells, but one out of us is a hyperactively overactive immune cell, and he makes a nonsense or nuisance. It's okay, that fine, hypersensitivity. But if I came to know that it's part of the class student, then it may be fatal for him. The grades will not be given proper to him. I'm saying a hypothetical scenario. If not Zoom bombing, it's our class student. If I came to find out that who is this person, it may be that I may elicit a response of fatality to him in terms of the grades. A classical example of normal immune cells, normal student, hyperactive student, overactive student. A hypothetical scenario. I'm not pinpointing anyone. I'm not blaming anyone. Okay, it's another words. It's called as allergy, a damaging immune response by the body. Damaging immune response, immune cells by the body respond to a substance, foreign substance. It may be especially a particular food or pollen, fur or dust to which it has become hypersensitive. That's called allergic reaction or allergy. These molecules or compounds are called allergens, and you may be allergic to something, I may be allergic to something. Based on one classical example, the poison ivy tree, the oak coming from the poison ivy, it brings some specific chemical molecules. When it touches with the skin, it may elicit an immune allergic response called delayed type hypersensitivity reaction. We will see that in further. Basically saying that a foreign body comes in touch with the skin, the immune system responds to it in a hyperactive way. You get rashes all over the body. That's a typical response of allergic reaction. On the other hand, if you take the substances of allergies that's causing in terms of a contact process through the skin, in terms of injection, not only simple contact, sending something inside the body, excuse me, or you are ingesting yourself something, or you are inhaling something through this process. The contact allergens may be poison plants, animal scratches, pollen, and latex. People are allergic to that. Specifically, injection may be snake venom or bee sting venom or some specific ants. If they bite, you may you may get an allergic response. Or medication in terms of penicillin or antibiotics. Usually, doctor asks, "Are you allergic to antibiotics before?" So they want to test that. They don't want to give one more dose of it, so that if your immune system responds very hard or harsh. Or specific nuts or shellfish, or it may be egg allergy, it may be milk allergy, that may be in terms of ingestion or inhalation. Again, pollen can come here in the dust and mid to cat dander. So based on these kind of starting material, many allergic reactions can come up based on the what kind of how the way that they are entering into the body. So what are the consequences of that? Your body responds, your immune system responds in hyperactive way. You may get a kind of something you ate, and you may get a kind of lips that are kind of bulged up, or it may get a specific rashes in the body. Each spot refers to a specific overdose of immune cells at each spot. They are coming here, they are dilating the blood vessels. As a consequence, the skin also rashes and a small bump will come up. It is each spot has tons and tons of millions of immune cells. It may be B cells or T cell, mast cell, natural killer cell. They may be, all of them may be here in each spot here you are seeing. And symptoms of allergy is nothing but a cough, itchy nose, a lot of itching. You may get edema, swelling of the body, or you may get vomiting and diarrhea. Some of these consequences are out of the allergic reaction. Your body system is cleaning it out of the body, the foreign thing, whatever it feels. So one more important consequence in terms of allergy is one more thing. Yeah. One more thing in terms of the allergy is nothing but anaphylactic shock. Okay. So anaphylactic shock is one of the fatal consequence where immune system can work. For example, in a case of scenario here, you are getting a foreign material, venom of the bee. Bee has stung a person through the finger, and in already the finger there is blood vascular system. The whole body, the blood is circulating in a normal way. When the bee stings, a foreign material venom has been entered into the circulatory system. It won't stay back here. Through the circulatory system, it can access the whole body, it can travel the whole body. By traveling so, as already it is recognized as a foreign material, the immune cells, which are already in the primary and secondary lymphoid organs, blood fluids, humoral B cell mediated, they are all available here. When they encounter the venom from the bee, they certainly respond in a harsh way. Initial memory has already happened. Second time the bee stung you, not only the first time. When the second time bee stings you, second exposure comes, you get into manifestation of several of these symptoms: sneezing, vomiting, diarrhea, we have seen, and heightened blood pressure, thickening of the blood vessels, all will happen to all over the body. As a consequence, you go into anaphylactic shock, the body will go into the shock. So how the response happens is nothing that some alien molecules are coming from the bee and they are making this response. Nothing happening like that. Your body has your own immune cells, protective agents all over the body, millions and billions of cells. But these cells hyperreact to a situation of the venom through a process of antigen antibody recognition or T cell mediated process. We will see. In a case, this is talking about the chart here, how the immune response. response to the B venom. You expand this chart, you look into that. So you're talking about your B cells here. So the first exposure of the antigen. Antigen triggers production of specific category of IgE antibodies. For example, allergen coming from pollen allergen, let's say, it comes into the body, it encounters the first time, you may get an illicit response from the IgE antibodies. IgE antibodies specific to this allergen has been produced and they have been sent it into the mast cell or basophil. They have been residing on these cells and normal blood circulatory system, first exposure, nothing happens. These cells go into the body, they just make the memory and they keep flowing into that. Consequently, a second exposure or subsequent exposure of the pollen or antigen or allergen causes them not to again trigger B cell produce more IgE. It causes and immediately this circulating cells with the specific antibody, they are the one first will communicate with this in terms of memory. And once they come, there may be a cross-linking. They may not go in terms of one antibody, one antigen. They may cross-link with multiple antibodies, antigen will form. It triggers a specific response of these mast cells or basophils to degranulate, release histamines, and the release is exponential, causing a vasodilation of the blood vessels. Normal scenario, normal blood tissue on the skin and blood vessels. And given this scenario of illicit response, histamines increase the dilation. See the basement membrane here. The membrane, the line here is ruptured. You don't see the line here. So that many cells will come and move through the blood cells here. And also it causes a dilation of the blood cells. You see thickened blood cells here. This is also consequence of the immune reaction for anaphylactic shock, anaphylactic reaction. So you are speaking of only helpful or protective immune cells overreacting to a specific allergen. This is the fundamental, but the type of the cell, type of the mechanism changes. We will see briefly. So, anaphylactic shock, what is it? Serious life-threatening allergic reaction that is rapid in action and may cause death eventually if you're not treated. Causes, common causes include insect bites or stings, foods and medication sometimes. So this is the fundamental of the anaphylactic shock. How do you prevent that? You basically, you try to avoid as much as allergens. Maybe if you had a reaction, mild reaction initially to something, your job is to avoid them, not to get subsequent exposure, second dose or further doses. Or you are unable to avoid it through the dust. You cannot avoid the bees. Randomly they may come and sting you. At that time, you already know that you are allergic to this thing. Your immune system reacts overly. So you need to keep allergic shots with you. That through immunotherapy you can suppress the system. The shots should be very friendly manner and it should be timely. You should not forget if you are allergic to something. You should carry the shots always. Or if it delayed response, you go in terms of medication. They mainly are antihistamines, corticosteroids. Antihistamines are to counteract histamine response. Corticosteroids are to counteract the inflammatory response, anti-inflammatory one. So on the other hand, you get a continued education of allergy and try to avoid what can preventative measures. Okay, so we came to almost 70% of the class today. Just a recap, we've spoken about fundamentally what is tolerance, intolerance, what is overreaction, hyperreaction of the immune system, what are the humoral and B cell, T cell and B cell responses in general. If in a hyperactive situation, in anaphylactic situation, how they will act, we have seen few examples. And how do you prevent the allergies, we have seen it. But coming on to one more recap, you need to talk about 4 types of hypersensitivity reactions. So let's recap in terms of the basics again. And in 5 minutes or few minutes, I will conclude the class in terms of introduction. Tomorrow we will take type 1 and type 2. So back to basics. In terms of the recap, an immune response mobilizes a battery of effector molecule that acts to remove the antigen or foreign molecule by various mechanisms we have been already discussing: humoral cell mediated, T helper T cytotoxic, B cell mediated, ADCC, inflammation, opsonization. So normal response, a battery of effector molecules, they will help to remove the antigen. Generally, these effector molecule they have whatever we have spoken, inflammatory response, not damaging the host tissue. They know that they don't want to kill the host blood cells, only kill the foreign molecule. They know the control, but however, it's out of control in some scenario. It causes a deleterious effects to the host tissue that causes a kind of damage or even death, anaphylactic shock. This inappropriate immune response from normal immune response to inappropriate immune response is termed as hypersensitivity or allergy. So allergy again has been divided based on the response. If you are responding to allergy immediately, saying that within few minutes to few hours, you are giving your body is responding and it's showing the explicit phenotypes or explicit rashes, swelling of the lips, edema. Then you are saying that immediate hypersensitivity. The type of reaction is called immediate hypersensitivity. But delayed type of hypersensitivity DTH, it doesn't elicit the response, or the obvious physical features may not come immediately in minutes to hours, but it may come in days, further days. So based on the duration of the response, return of the response duration, it's called immediate hypersensitivity and delayed hypersensitivity. And whatever you talk about immediate, whatever you talk about delay, immediate response means you are looking for immune cells that are actively available, freely available, and available in the blood. So basically, in immediate hypersensitivity, only the antibodies will act. They are the one humoral cell mediate. Humoral immune system only works in immediate hypersensitivity, but delayed type hypersensitivity is responded by T cell mediated response. Fundamentally, two types: immediate, delayed. Immediate is antibody based, delayed is T cell based. So again, in the antibody based, we have seen that antibody can do multiple functions in terms of complement, in terms of opsonization, in terms of ADCC. It may work differently. So based on the different mechanism how an antibody responds to the immediate hypersensitivity, it is further classified into three types: type 1, type 2, and type 3. So the type 4 is called cell mediated, T cell mediated response. But the 1, 2, 3 are antibody mediated responses here, and the type 1, type 2, and type 3. Type 1 is based on fast response, immediate response, very fast to allergic reaction within few minutes, and it is mediated by antibody IgE. And we see what mechanism happens in the next class. Common examples are asthma and allergic rhinitis. And type 2 is type 3 are kind of intermediate response in hours, for example, say, or little bit not minutes, it may take some time. And type 2 is mediated by IgG and IgM antibodies. Type 3 also IgG and IgM. But the difference between type 2 and type 3 is that they act in a kind of single antibody antigen here. Typical complement response will come up here. We will see that. But type 3, though it is antibody dependent, it involves a complex antigen antibody complex molecule, not the single one unit response. It acts as a complex. When the complex of the antigen antibody comes, type 3 response will come. Individual antibody antigen as a classical way, type 2 response. But type 1 is also similar, but it is a response towards some specific allergen molecule, anaphylaxis, and response of IgE antibody through basophils or neutrophils. We'll see that here. Mast cells are basophils here. We will see that in the mechanism. But and type 4, there is a spelling mistake here. Type 3, it's not type 3, it's type 4. It's a cell-mediated immunity. T helper cells are the one. It's a response of 48 to 72 hours. It is cell-mediated cytotoxicity. It's a typical example of transplant rejection, or contact dermatitis. We will see the examples, how the mechanism acts in the further classes. So you again typically look into the kind of mediators, looking the onset of the response. Examples in a given scenario, you can distinguish them. Type 1, IgE within 1 hour or minutes, anaphylaxis. Type 2, kind of IgGM, cytotoxicity, hours to days. Type 3, complex mediated, response with neutrophils, we will see that. And then 1 to 3 weeks here, but type 4, days to weeks, T cell mediated. Okay, we will look into the mechanism. For example, and fundamentally, basically nothing but when type 1 is involved, IgE antibodies are involved. They crosstalk in terms of mast cells, and then basophils, ask them to release or degranulate, release the histamine molecule. Where the IgE is there, histamines are involved. IgG and IgM are there, activation of complement pathway, classical antigen antibody. The complement enzyme cascade will be activated, lytic pathway will be activated. These are the effector molecules in this type 2 and type 3, type 1 IgE, and type 4 cytokines in terms of T helper and cytotoxics. So that basically we will take in the next class how each mechanism works. Through that we will talk further. But if you don't remember the how each one acts, all the cells are same, but how you are saying type 4, how I can remember, you can use acid ABCD. ABCD. In type 1A, anaphylaxis, allergy and atopy. Type 2, classical antibody B. Type 3, immune complexes. Type 4 is delayed. ABCD. Based on that, you can work through your conceptual